Hello, everyone, and welcome back to the Holistic Nurse Academy, where we bridge the gap between Eastern and Western medicine. And we have an awesome guest today. Her name is Rosemary, and she's a registered nurse with lots of holistic experience. I'm truly excited to have you on today, Rose, to teach us your ways because you are so good at what you do. And
Thanks, Holly.
yeah, you're welcome. And we'll be diving into, who you are, how you came into the holistic modalities that you have, and probably talking mostly about essential oils, but some of the other things today. But first, Rose, well, first I want to say, I think when we talk about a holistic nurse in the academy, we talk about being an option giver. And you are so good at being an option giver. And I've seen you firsthand, at work, or I've been in with a patient who has been case managed by you, and I see all the things you're doing for them, and they're like, you know, Rose told me this, or Rose told me that, or she showed me this, or showed me that, and they feel so excited, empowered by it. So you truly embody an option giver. So I love that about you. Why don't you tell us a little bit more about yourself, your background, just a little, history, so we can get to know you a little bit better.
Sure. Well, I got my nursing degree from Westminster College, graduated in 2004. I have worked in research. Uh, I have worked at the VA hospital. I've done long-term care and home health and hospice. Um, and as I'm nearing the end of the official part of my career, I'm leaning more into the holistic side of things. And often I think we find when we use Eastern and Western medicine and they come together, that's where we can get some of the best outcomes.
Yeah,
We're nurses, we're not doctors, we're not telling people to stop taking medications, although they can choose to do that if they're getting good enough effects from other options. But just giving people options, and empowering them. I think
yeah,
the health industry is so overwhelming to a lot of people. Giving them even a little bit of control really is helpful to them, and
yeah.
it helps them make some major changes. I think of like an if you change the setting even 1 degree, you're going to end up in a different location. So even
Hmm.
just making small changes in their lives can make a big difference. And if we can educate and empower them to do that, then we're on the right track.
Yeah. Amen to that. I totally agree. Um, I never know what part of the journey people are on with us when they watch these. So sometimes I might repeat things I've said before. But one of the things I have learned, I would say in the last 5 to 10 years, really truly embraced, is just being more attentive and listening to what patients want, what they're asking, being present with them, and really holding space for their needs, and not just kind of going in there and saying this is what we're going to do. And you're
Yes.
really good at that.
Um, I'm going to put that on Dr. Amador, one of my communication teachers. She said we have two ears and one mouth, and we should listen and talk in that ratio.
I love
And
it.
I think doctors, if they listen to their patients a little more,
Mm-hmm.
would find the solution to the problem a little faster.
Mm-hmm.
And we can be more proactive and do that.
Yeah. So, for you, has it always felt natural to kind of bring these things into your nursing? I know for me, I felt like I lived two lives. Um, I was over here delving into what we call holistic or alternative modalities. And then I felt like my left brain was over here and I was doing kind of, the dutiful thing. And it took me a while to blend the two. What about you? What was your journey in that?
I agree. It was kind of the same. You're learning over here. and then kind of developing a comfort level
Mm-hmm.
through education and practice in your own life, and then moving it forward into your patients and really asking their permission if they're open to alternative things. And I like to offer, something really basic, like, can we, because we are absolutely allowed to educate people on food,
Mm-hmm.
what food thing could be done.
Mm-hmm.
Then moving into essential oils, like if we take a lemon, you could squeeze the juice from a lemon and, drink some lemon water can be very beneficial to the body. But if you took a bottle of lemon oil, that's like incorporating a whole field of lemon trees into
Gotcha.
one bottle.
Yeah.
So it's a lot more condensed and they can see results a lot faster.
Yeah.
So,
Well, I know this is kind of a side note, but I was reading once, okay, I can't quote myself here, but um like a liver cleanse, when you do a liver cleanse and people like, "Oh, the lemons are really good for your liver." But it takes an exorbitant amount of uh lemons to cleanse your liver, so like, something like something that's really concentrated like an oil would probably be better, but anyway, that's a
and
side note.
doing
What do
the,
you think?
the timing of that as well. Yeah. Like the traditional liver cleanse, you would do, you want to squeeze the juice of a whole lemon and you're consuming that several times a day, trying to get that lemon out.
Mm-hmm.
But, one or two drops of lemon oil could give
Yeah.
you the same effect.
Yeah.
And it's quite a bit more palatable and probably a little bit easier on your gut as well.
Mm. Yeah. And way
Um,
easier, way more convenient.
Also doing that on an empty stomach. So that's a key point that some people may not be aware of.
Mm.
So if it's done on an empty stomach, it's a lot more effective than if it's with food.
Got it. Cool. Yeah. See, you already like, I just love how much you know. So, did you start, like, what was kind of your gateway drug for integrative therapy? Like, as I like to say it, for me, it was like I was um, diving into Reiki and energy work. For you, was it essential oils or was it something else?
Kind of tiptoed in through some whole food nutrition. One of the daughters of one of my patients, um, she was also a nurse
Mm-hmm.
and I think has actually taught some holistic classes. And she was doing some things with her mom, and I was her hospice nurse and uh, doing all kinds of things that, bed sores were not a problem for her, where, her body was still declining, but she could do it without a lot of the other symptoms that other patients were having. And
Wow.
so I tapped into that and kind of using whole foods as a way to do that, and then got introduced to some oils for some friends. And I've probably been using essential oils for about 12 years now.
Okay. Yeah, and you're really, really knowledgeable about them. I think when we get into this topic or any of these topics with medical professionals, you're going to get a gamut of responses. Some people are very resistant. Some are, okay, that's cool, but what does that have to do with me? And some people just really embrace it and
Yeah.
want to go for it. So, kind of finding that middle ground of there's a lot of different ways that people have been introduced to essential oil. So let's just talk about it from a practical level. Like, what are they? Um, why are they beneficial? How do we use them practically, in a healthcare setting where they don't feel silly or woo-woo-y, where they feel practical.
I'm going to jump back just a step from what
Okay.
you said earlier,
Okay.
is how, where people are on the spectrum. They're
Mm-hmm.
over here, never going to touch it to,
Yeah.
my oil Houdini and I do everything oils.
Yeah.
Um, Often it's a pain point, and not necessarily pain, but a trigger point like this something is intolerable in my life.
Mm-hmm.
And so now I'm actually going to be ready. I'm either going to go talk to a doctor, I'm going to talk to somebody, and
Yeah.
I'm ready to take action in my hands and find a solution. So when somebody has a pain point and they're ready to act on it, then that's the time that we have an education opportunity. And that's when you want to jump
Mm-hmm.
in. Like we were
Okay.
talking about the liver cleanse. Maybe somebody is comfortable using lemon juice, and you maybe start there and then they try that and wow, okay, I feel like I'm getting some liver cleansing, but boy, my gut sure is hurting. And then they're open to looking at other options.
Yeah.
Or even presenting, you have three options. You can talk to the doctor. A doctor and a liver cleanse, they don't really know anything. They're not, most MDs get one nutrition class and they're not taught how to heal. They're not
Mm-hmm.
taught how to prevent disease, that kind of thing. And we kind of think that they are. So, um, we have the opportunity, and I think just presenting people with choices can take a little bottle of essential oil and just put one or two drops in some water. We want to do that at a fasting time before, before breakfast, at least a half hour, and we could do it at bedtime would be another option. And sometimes I think in a lot of things, as we do in nursing, if we put a 2-year-old face on it. Give somebody an option that is you can kind of guide them, you know, what's the option that's going to give them the best effect?
Mm-hmm.
And you can help educate them through what those options are and sometimes they'll make the lemon juice option choice.
Yeah.
Sometimes they'll say, yeah, I think I'm going to do that lemon oil. That's going to be worth a try.
Yeah. So what do you, let's now switch roles and how do we take that approach with clinicians, where they feel comfortable using essential oils as a real actual solution to a problem and not feeling like it's silly or outdated.
I think sometimes you have to get that personal belief with yourself. If you've tried it yourself and it works, then
Mm-hmm.
you know.
Yeah.
Um, we're kind of on a lemon oil theme. Most of us occasionally get acid reflux. So if we put a drop or two of lemon oil in some water and sip that after a big bowl of chili or something, where a lot of people could have some reflux and find, oh, wow, that really worked.
Mm-hmm.
And I think about Um, with it being scary, like if you went to a great restaurant, you would tell all your friends about it.
Mm-hmm.
And, you're not getting a kickback or anything, but you want to share good things with people you care about.
Right.
And we care about our families and our patients. And I think it's okay. It's almost a disservice not to share it with them.
Yeah. Well, and we're blending the worlds, right, of Eastern and Western, where by
Yeah.
having some knowledge about it, we're empowering not only ourselves and our families, but our patients as an option giver. So, what kind of research is there behind essential oils that you know of that kind of backs them up as valid? Do you have any off the top of your head?
They're looking through PubMed. You can find gobs and gobs of research.
Hmm.
Um, Probably lavender oil is the most researched oil out there, but all of the essential oils have significant amounts of research on them.
Yeah.
So if you have a concern or a question, and there definitely are, some things that you want to be aware of, like some oils are dangerous for pets.
Hmm.
I love tea tree oil, but it's particularly bad for dogs and cats.
Hmm.
So you can still use tea tree oil if you have a dog or a cat, and you need to have it used in a place where it's not an enclosed room. They need to be able to exit the room, if their
Hmm.
senses are uncomfortable.
Yeah. Um, and like another population that's important to remember, like pregnant women. I know there's some
Yeah.
contraindications for pregnant
Pregnant
women.
women and infants, especially, and small children, very small doses can be very effective. And like, who wants to be a guinea pig to be tested when you're pregnant?
Right,
So there's little to no research on oils in pregnancy.
right.
Um, so you have to do, I have used some, um, especially the heartburn kind of things, but some of the heavier, stronger oils, I was very lenient or very careful with
Hmm. When
when
you
I
were
was
pregnant?
pregnant.
Yeah.
Yeah.
Any other populations that stand out to you that might just kind of be on the radar? What about
Um,
allergies or people who have sensitivities?
I think you always want to do a spot test, and it's always good to go slow and work your way up. One of the great tips to do with essential oils is use a carrier oil. That
Hmm.
can be as easy as putting it with some lotion. And I would use
Hmm.
a good quality lotion. You could do olive oil, fractionated coconut oil, um, anything like that.
Hmm.
And that slows the absorption of the oil. So you mix the oil with whatever oil, lotion, and then apply it to the skin, and
Hmm.
then it absorbs more slowly.
Hmm.
And I'd also like you could do a little patch test right on the inner arm here and just do a tiny bit and just make sure somebody's not having a reaction for the first time.
Yeah. And you'll dive more into that, dive deeper into all of these things in the course you're going to that we're going to have on our academy. So this is just kind of an introduction to those themes that you'll be covering. So we don't need to go, too far down those themes, but I kind of want to talk about it from a practitioner's perspective, um, at bedside or case managing. I think it's a little easier in someone's home to introduce the oils because we're not beholden to policy and procedures of a facility who has to think about all of the comforts of everybody in the building, right? Like, not everybody likes the way they
Yeah.
smell, um, or can tolerate it, etc. So in a home, it's a lot easier to say, "Oh yeah, we can use it in your home," because it just affects the family or the patient. Um, but I kind
Yeah.
of want to talk about it a little bit in practice. The practicality of doing it in practice. I think in nursing homes, I've seen that you can write an order. If you get a physician's order, you can write an order, put it in the patient's chart,
Mhm.
and then use it for whatever purpose in that way. Maybe
Yeah.
talk about a little bit about that. Have you seen much of that?
It's becoming more and more. I know the VA is embracing more of the alternative types of things, and it definitely in home health and hospice, I've seen it. Um, when I was working in long-term care, I hadn't seen it worked there unless it was with a hospice company.
Hmm.
Um, but just deodorizing a wound can be tremendous
Yeah, I
with
was
what
just
that can
thinking
do.
that wound care. Yeah. So
Hmm. From
tell me a little
healing
bit more about
wounds.
that.
We could do a whole session on wound
We.
care. Um, but yeah, just yeah, limiting bleeding. If you can stop a wound from gushing blood, that's gonna help a wound. If you
Hmm.
can promote healing and encourage the body's natural healing process to happen, that's going to be beneficial.
Yeah,
And there's several oils that can help with that.
I love that. I love those thoughts. I think oils are healing even just from a smell perspective. Um, we were kind of discussing the limbic response to oils, and then you were saying that oils can cross the blood-brain barrier.
Yeah, and
But
that can be
go
good and
ahead.
bad. Um,
Yeah.
Most drugs would love the ability to cross the blood-brain barrier, but again, we have to be careful with that. You do also want to be careful with the amount of oils that you're using,
Mm-hmm.
um, because you can desensitize, especially with that limbic system. Your body cannot handle more than 12 drops of oil in a given day. And
Wow.
you can basically stop their effectiveness for several years if you overdo the oils. So they're powerful, but we need to do them in small doses.
Okay. That's great to know. That's really good.
Yeah.
Um, which is why I think like the class on essential oils from a nurse perspective is really going to be, you know, powerful to cover all these really important foundational parts. Um, so let's see, what other, well, let's talk about the quality of essential oils, because there's so many out there. Let's just kind of talk about that real quick, when
There
using them.
are. Yeah, there definitely are a wide range of quality of oils. Um, and sometimes things, don't matter on a brand. If I'm going to buy a Tylenol or a Benadryl, if I get the Walmart brand or I buy the name brand, I feel like those are pretty similar. I'm going to
Hmm.
get the same effect. For me, Q-tips, like gotta have the real Q-tips.
Yeah.
In fact, I have some at my Q-tip. Gotta have the real
Very
Q-tips.
important.
Yes.
Isn't that funny?
Um, so some things the brand matters and some things it doesn't really. They've really, generic things have come a long, long way. And often they're made side by side in the same factory, on the same production line. So you really would not know the difference. But in oils, it is a wild west out there. It is completely unregulated. Um, People can do whatever they want.
Hmm.
And, everybody's in their, we're a capitalistic society. We're out here to make, people are out to make money.
Right.
And some people will do it in unscrupulous practices.
Yeah.
Um, my sister had the cutest little dog, and she had this little box of oils, and she had like four or five different brands. And the dog was always really curious, and he had the funniest reaction. She would open, we'll pick on Walmart. There was a Walmart brand oil, which of course was very inexpensive. And that dog smelled that oil. She wafted the bottle under his nose. He took off, ran across the room like he wanted nothing to do with that.
Yeah.
And then a higher quality oil, um, he would smell that and was wanted to hang out. It soothed. He was calming. Sat down right, next to the box. He was very comfortable. So, and you can, if you're smelling bottles side by side, you can really get a sense of it. But
Hmm.
I would be really hesitant. If you can get a 4 ounce bottle, I've seen it on Amazon, a 4 ounce bottle of lavender, for $8, I I would probably run. I would be
Yeah.
like that little dog, run screaming.
Yeah.
It's not going to be effective. Probably my biggest concern is that a lot of those lower quality oils, they're using hexane in the distilling process, and it maximizes how much oil they get from it. But hexane is cancer causing,
Hmm.
and that's kind of negating all the good that we might be doing with oils. So the other thing that's cool with oils is, and this is with life, everything has a frequency. The frequency of death, I believe, is 25. You'd think it would be zero, but it's 25.
Okay.
Um, Even looking at foods, you can get like processed foods are like a negative 15.
Mm.
So we need to look at it. It matters what we put in our bodies.
Hmm.
Um, I think the lowest essential oil is somewhere around 43. Um, So any kind of oil is going to bring us away from that death measurement. Some of the really high ones, frankincense, rose, are end up in the hundreds,
Wow.
which is pretty amazing.
Yeah.
So sometimes if we don't know what to do, but we want to just increase the frequency in our body, and different smells attract different people. Like we've mentioned, lavender. Lavender's not really my favorite smell. If I mix it with orange, I find that I can diffuse that, and that's very comfortable, and I can get the effects without having that heavy lavender kind of smell.
Hmm.
Or I can just diffuse something that I like, but I'm getting that frequency elevation in my life and in my body, and probably those around me too,
Hmm.
which
Yeah.
is great.
Love that.
Yeah.
That's awesome. So we covered skin sensitivities, we covered,
Mhm.
workplace considerations, quality matters, why not all oils are the same. Um, which you're going to cover more in depth in your class, so we'll keep, you
Yeah.
know, that for that. But really important, that's really, really important, for all the reasons why you were saying. So I'm just wondering real quick, I know that there's just practical, real world uses for nurses that can use this for themselves or in their own practice.
Hmm.
Um, I do it to de-stress a lot. I love a good oil that smells earthy and grounding. Um, as you can tell, I have a little bit of a nasal congestion. I was using an oil to help clear my sinuses or just bring me comfort because I love the smell of oil called Breathe or peppermint.
Yeah.
What are some other ways that you can think of that are practical uses for it?
I love diffusing oils when I'm charting. That's a fantastic
That's a good
option.
way to use it.
Yeah, there's a kind of a focus blend. You can do a citrus oil with peppermint.
Hmm.
And I love like peppermint with a eucalyptus. You feel like you're in a spa.
Hmm.
Very kind of soothing, but it keeps the mind awake and alert. When I worked in research, and I often would do that as on a night shift. That's a common blend that I would do to try to keep us awake through the night.
Nice.
Um,
Love it.
and we didn't do it in the patients' rooms, but as they were walking by the nurse's station to go to the bathroom or something, they're like, "Wow, it smells really good in here," things like
Yeah,
that.
yeah. I saw a
Um,
nurse, or I've seen nurses put it in their face masks, um, if especially home health. If you're going into a home that doesn't necessarily smell pleasant, or you're dealing with a wound or something that doesn't smell pleasant, putting it in your mask. Um,
yeah, that can definitely be a big factor. Working with cancer patients, and typically I don't wear a cologne, but I have used essential oils as, like just a simple orange or something,
mm,
um, that makes me feel happy and
like
calm,
a
that smells,
mood booster.
and the cancer patients they're not offended with that.
Okay.
So that can be a way you're basically, when you put the essential oils on your skin, you're like a walking diffuser everywhere you go.
Yeah, yeah.
Yeah.
Yeah, orange and grapefruit, those ones are very mood boosting,
Hmm.
for me. They just like
Yeah.
lift
Sometimes
the
I'll just
room.
put just right here, and it just your body heat just wafts up and is really great, especially, yeah, when you're having congestion or a cold.
Yeah.
Those are great
Well,
options.
what's nice about them too is they're portable.
Yes,
Um, they're
that's a
relatively
great option.
affordable, right? I mean, there's some that are
Yeah.
expensive for a good reason if you're buying high quality, but
Yeah.
um, you can with using a carrier oil, you can let them, the life of them extend for quite a while.
Right. And one of my favorite things are roller balls. And I think in our class, we're going to hit several recipes for some amazing roller balls. And that can really extend, your use of the oil.
Yeah.
and it's a lot more cost effective and it still works for the body, which is
Yeah.
great.
Yeah. I like them too. And I like all of these different options for patients because we all, at least, like I would say, 1 in 10 patients that I've worked with, there's going to be one that's kind of this outlier that they're like meds don't work great for them. They struggle to
Mhm.
take them. They don't metabolize them well.
Yeah,
You know, for whatever reason, the medicine, like unless it's life saving or they really have to have it, is not the best option. And so this is just another tool in the toolkit that's like, well, have you tried this?
yeah,
And in fact, I know that you've used oils as a solution for patients like who don't want to take antibiotics to help them like heal. Correct me if I'm
yeah.
wrong, and obviously with a doctor's order and everything, but like a ingrown toenail that's starting to fester, for example.
Yeah, herbs and essential oils can be as powerful as antibiotics.
Yeah.
So there's some great solutions. Um, Pain is another amazing thing that oils
Hmm.
can do. I know I've had one patient that she had a spontaneous T12 fracture
Hmm.
and was not able to tolerate basically any pain medication except Tylenol, which is not really going to manage a fracture well.
No.
And we were able to get her to be able to sleep. I think we did use some lorazepam with her as well. So we're
Hmm.
blending, the Eastern and Western together. Uh,
Yes.
but
Love
we're
that.
able to heal and manage the pain from that with essential oils.
Yeah.
So that
Well, and part of being
was
holistically
enlightening
mind.
for
Oh,
me.
sorry. Wait, say that one more time. I interrupted you.
I thought it would just reduce the pain. It almost completely knocked the pain out.
That's
And
crazy.
I was impressed,
Yeah.
but
I
there
love
was
that.
no other option. So, you're digging in your nurse toolbox. Okay, what else can we do? What are the options?
Yeah.
And she was open and we had tried some other things. So we did it and she's loved it.
Well, and the way I tend to use oils in practice is in combination with touch. So I create with oils, as we're looking at the bigger picture, the healing environment. So
Mhm,
first course I shared was the presence that we bring, but
mhm,
something that's also really important is the environment we provide. And for me, the smell, the intention of why you're using the oils to assist, aid,
mhm,
bring intention to the patient or the client. So a little bit of oils mixed with the right kind of therapeutic touch, mixed with, whatever intervention you're using, can really just give like this 3D experience, even
yeah.
4D, 5D experience where you're just really getting the smell, the touch, the feeling of, somebody's intention, and then that creates a healing environment. So to me, it's more than just like what it can do, but it's like it's part of this bigger picture of therapeutic environment.
And I love that yeah, you can use the oils on yourself and
Hmm.
boost your mood, your
Hmm.
calmness, de-stress, because nursing, let's face it, can be very stressful.
Yeah.
So just managing our symptoms with the oils can be beneficial to our patients.
Right.
Um, Then if we're having them on our body, just the aroma from
Yeah.
us, they're getting little microparticles
Yeah.
and, hopefully improving their stress and situation to then developing an interest and just seeing if there's an openness. And then even if they don't do it in the hospital or the care center, maybe they go home and incorporate something to improve things and keep them out of the hospital.
Yeah. So,
Yeah.
and then just to kind of bring this together for anyone who's a clinician wondering, okay, how does this work in picture? So, your client or patient has pain, your intervention is, if you can, pain medicine or whatever the medication is that you can give them. And then you add essential oils with a therapeutic foot rub or essential oils
Yeah,
applied to the site. And then you document what you did and the response to that and the outcome. So I see often with what I do with these different modalities where I'm using essential oils and touch, anxiety levels and pain levels at least drop 2 points, if not bigger, in
yeah,
most cases. What do you see?
absolutely. And definitely, I've loved the classes that we've taken together,
Mm-hmm.
and I've been incorporating that and just like the acupressure points.
Mm-hmm.
And if you added the oils on top of that, you're going to
Mm-hmm.
exponentially
Right.
benefit.
Totally.
Definitely.
I think they complement
Yes.
therapeutic touch modalities so wonderfully. Like they just are like this beautiful blend. But I also like using them how, we've talked about just using them on their own. So there's a lot more we could dive into, but what I don't want to do is spoil all the wonderful things that you're going to teach us in your class.
Yeah.
But maybe give us a brief overview of what you plan on covering or what your class does cover, essential oils. It's like a basics class.
So we're going to talk about how to really in depth figure out what is a good oil. So you can take that home and figure it out very easily. We're going to have some great roller bottle recipes. So, if you get a few essential oil bottles of good quality, you can stretch those out and, work that into the budget. We're going to talk about specific things you can do to bring that into your nursing practice, different settings, and how that will all work. And we're going to talk more in depth on the frequencies. I'll show you that really cool table that talks about how the frequencies and, different things that we can do to bring the frequencies up in our lives. And I'm a lot about longevity. I want to live to 120. So that's my
Wow.
goal. Um, we'll see if I
Good
get
for
there.
you.
And I want to go, I don't want to be there just on a, in a hospital bed. I want to be doing well.
Yes.
So,
Think we can all attest to that. We've seen
anything
enough.
we can do to that.
Yeah. We've seen enough of what
Yeah.
aging looks like that we know we want to be vital as long as we can.
Yes. So anyway, incorporating that in and diffusing, there's some great fun diffusing recipes. I think we'll throw a few of those in there. There's a fun few Christmas blends. I'll make sure we have that focus blend in, immune support, things like that.
Okay.
And I think it'll be a great class. Hope to
Yeah.
see you there.
Yeah. I'm excited.
Yeah,
Um, Thank you for sharing your knowledge. We could probably talk forever and go really in depth on these things, but we
we
won't.
could.
I could too. I was just thinking, as you brought up the roller bottles and making recipes, like I remember when I was seeing patients in homes and, wherever I was, I would carry around my little case, like just with my bag of stuff, my stethoscope, my blood pressure cuff. I also had my oil case with me and I would use it when I needed it.
If you carried 3 to 5 oils with
Yeah.
you, you could do a lot
Yeah.
and
Yeah.
help almost any situation be better.
Yeah. So that's perfect.
Awesome.
Okay, well, thank
Okay.
you so much for being here. And just so you know, Rose, she's not just the essential oil guru, she's many things. So that's where we're going to start, but she will also be bringing us other really great topics because she has so many tools in her toolbox, right?
Hope to see you in the future.
Okay, thank you. Bye,
Thanks.
everyone.